Kamusta ang inyong tulog? Nakaranas ba kayo ng muscle cramps sa gabi o pamumulikat? Ever since na nagsimula kayo ng carnivore diet or all-meat diet? This is in response sa question ni Sir Tony, very active sa ating group and also very, very helpful in Life Without Rice and Low Carb Feasting and Fasting Community. Hindi actually pang super newbie yung kanyang question, but this is very important question wherein na yung wife niya, 97% of the time, halos naka-carnivore diet, parang all-meat diet. And kahit pa umiinom siya ng electrolyte drink, ay ganun pa rin. Meron pa rin muscle cramps. And the question now is how to strike the balance, especially na yung wife daw ni Sir Tony is umiinom din ng magnesium na tablets. So with muscle cramps, we have to know kung ano yung mga different na mga electrolytes na involved dito. Sometimes it could actually be not electrolyte. Pwede siyang lack of water. Dehydration can also cause muscle cramps. So although hindi na tayo nag-a-advise na uminom ng maraming tubig before bedtime, but it is very important that you also take your needed intake of water during the day, especially when you are most active. Kasi kapag napabayaan natin yung ating water intake during the day at puro na lang tayo dry fasting at hindi na tayo very mindful sa ating kinakain, then you might have some degree of dehydration kapag natutulog. And it can have a manifestation of muscle cramps. Another is sodium. So salt is very, very important. So with carnivore, usually, hindi naman tayo nangangailangan ng maraming electrolytes, even magnesium, because ang mga foods natin, especially kung kumakain ka ng mga organ meats, meron naman yang embedded na yan with electrolytes. But the salt is really essential. Yung pag-intake kasi ng enough salt, so yun yung isa rin sa pinaka-importanteng ingredient na magpapasarap ng ating meat. But this is more important sa ating katawan. It will make sure na hindi magkakaroon ng imbalance sa loob ng katawan natin. So the number one electrolyte that you should be thinking after na okay yung inyong water intake would be your salt intake. But after, if for the longest time, hindi pa kayo nag-increase ng inyong salt intake at wala rin kayong iniinom na other pangpares ng ating sodium ng salt, which is potassium, then most likely, pwede na kayong nagkaroon ng chronic hypokalemia or so long-term na pagbabana ng ating potassium. Because with carnivore, di ba tumataas yung ating nitrogen na spending. So it can lead into elevated uric acid, elevated BUN. So all of those, kailangan ilabas ng ating katawan. However, hindi yan lalabas ng ating katawan kung wala siyang pang-balance. So yung pang-balance or pang-exchange niyan sa ating kidneys para ma-eliminate sila successfully would be potassium. And para ma-eliminate sila, kung sobra-sobra yung kinakain or hindi enough yung potassium na kinakain, then pwede kang magkaroon ng electrolyte imbalance. Potassium is actually isa sa mga pinaka-common manifestation niya kapag mababa sa katawan is muscle cramps. So that's why it's not about your intake of magnesium, but try to look at your intake of potassium. You can continue your magnesium because yung kailangan nating magnesium nasa 400 to 600 grams in a day. So a minimum lower RDA na number is already okay, just to be safe. Okay? And generally, kung hindi naman ganun ka physically active, hindi rin ganun kakailangan. Hindi ko na nga ma-recall the last time that I took magnesium. Siguro nung nag-gym ako mga 3-4 weeks ago pa. But that one, not generally required, especially if hindi ganon ka physically active. But potassium in a day, we need 3,500. So 3,500 milligrams of potassium. At kaya nagkakaroon ng muscle cramps even with electrolyte drink. Kasi yung isang electrolyte drink solution, isang 1 liter niyan, nasa 500 lang naman yan. And then kung umiinom pa ng potassium tablets, that potassium tablet is just 99 supplementary dose. So konting-konti lang. Generally, like in my experience, in personal experience, a family and my immediate friends and my the certain patients that I managed before, they also don't need 3,500 talaga na potassium supplementation in a day. With intake of food, even if mostly carnivore, and then pakonti-konti lang, paminsan-minsan, merong mga vegetables that are also loaded with potassium, green leafy vegetables. Usually, hindi sila nangangailangan ng potassium intake. However, pinakakailangan na meron kang potassium intake if nagkaroon ka na ng symptoms ng low in potassium. And even if ipapakuha ka ng laboratory result, it could be a possibility na yung lalabas sa resulta ng inyong laboratory would actually be normal because yung katawan natin, it is trying to maintain balance sa ating serum, sa ating plasma, in our bloodstream. So, balance yung potassium dyan. However, potassium is an extracellular na electrolyte. Ibig sabihin, nasa labas siya, nasa dugo. Wala siya sa loob ng cells. Yung nasa labas is supposedly sodium lang. And yung potassium na kailangan dyan is just very little. For you to appreciate, yung normal level ng sodium, ng asin sa ating dugo is nasa 130. But ang normal level ng potassium sa ating dugo is nasa 3.5 to 5 lang. So, konting-konti lang. That's why, pwedeng hindi maglalabas ng abnormal or imbalance ng electrolyte sa inyong dugo kapag nagpakuha kayo niyan because your body already compensated. Pero yung nasa loob ng cells pala, dun na pala yung kumukulang yung potassium. That's why hindi siya makikita sa laboratory but makikita siya, tawag natin clinically, sa symptoms. And muscle cramps, our muscles, sila yung pinaka very active always. So any muscle movement ay related to the electrolyte because it's about electrical activity, positive charge, and negative charge ng mga ion sa ating katawan. So, if walang potassium sa loob ng cells, pwede siya magkaroon ng short circuit. So, it's very hyperactive. Kaya siya biglang nagko-contract. And it is already causing the pain, the muscle cramps, because the potassium inside is already very low. So, when it comes to muscle cramps, most likely, especially with carnivore, all meat eaters, it's mostly the lack of potassium. So, you might need some conscious increase sa potassium intake when it comes to muscle cramping para ma-address muna yan, to address the imbalance. And after that one, hopefully, you won't need to do external supplementation anymore once you've already corrected that. And you can just maintain that normal potassium with a balanced intake of sodium because sodium, again, the salt, will lock in the potassium that is already inside. But right now, if meron ng negative, meron ng kulang, so kailangan mo na i-replenish. So we need correction. So you can consult your doctor how to correct your potassium. Merong increased potassium na dosing, therapeutic dosing, 500, 1,000, 80 milligrams na load, and there are even higher doses depending kung ano ibibigay ng doktor nyo. And also, most important, this is also the reason why yung iba na nagsisimula pa lang when it comes to low carb, especially for those na merong tendency to have gouty arthritis or merong mga pagtaas na kanilang uric acid. This is also the reason why, because when you are eating mostly meat, it's also not with balance of potassium. So that's why kailangan talaga balance sa ating buhay. And we are now back to work at aalis na ako. I need to go bago ako malate. Maraming salamat. I'll see you again in our next video. And also, if you wish to know more, because most of our masterclass students is hindi nakaka-experience ng mga imbalance na ito because they are already having the right mindset sa simula pa lang. Before they started low carb, before they started fasting, they already know kung ano yung i-expect at kung ano yung paghahanda so that hindi nila ma-experience yung mga usual and common side effects of doing low carb and fasting. Not the best way, not the best practice. Of course, maganda rin if you do it on your own, you learn on your own. But if you don't want to take risks and if you want to do it right the first time, then I welcome you to join our exclusive group, the Low Carb and Fasting Masterclass by yours truly. Message nyo lang yung admins natin if you wish to know more. For now, remember to always stay low carb so that we all stay safe. Bye, everyone. Thank you.